hear from you if you'd like to just chat in the chat box about how this year has been for you so far. What have you learned? What's been difficult? What's been kind of some silver linings to all this that's been going on? I'd love to hear from you. Just anything at all, how you're doing, just put that in the chat. So we have a number of our practitioners on here today as we all function as a team. Not everyone's available today, but we will also highlight them that are not here today as well. So we're going to talk about the year in review a little bit, briefly, what kind of we've been doing here, some upcoming events and opportunities that we're having as well, and then meeting some of our integrative team and hearing about the services that can up-level your care and your health. And so we do have in service of that a thyroid group visit that's coming up on Tuesday, June 29th at 1 to 2 p.m. If you'd like to attend that, please put your interest in the chat box, or there's a form in the chat box to fill out, and Jen and I will be doing that next Tuesday, so look forward to seeing you there if you are interested in thyroid. So the year in review, I think just to make that somewhat brief, so we've had the pandemic, it's still going on. Luckily in Montgomery County and other parts of DC, it is becoming less and less of an issue from a perspective of the number of cases. You know, certainly I know here in Maryland, the governor is saying that the state of emergency is over on July 1st. And in Virginia, I think it's June 30th. So I think one day before. But, you know, it has been a very challenging year for us, but also a very blessed year. I'd have to say that, you know, we're still here, we're doing well, and we look forward to being of service to you in the future as well. We have done a lot this year to help build community, to help with education and kind of helping you help yourself to empower yourself to take charge of your own health, which is kind of where we're kind of going with things. We know that many people have gotten COVID and or know people that have had COVID, even that have died from COVID or associated conditions. So we just want to have a moment, I think, if you'd like to just close your eyes and just put your hand on your heart and just for anyone, all of us here, all of us on this call today and listening on social media as well, just sending a message of, you know, good, positive intention and compassion and just some love to everyone that's been affected. Just feeling the breath go in and out, diaphragm expanding and contracting as you send some energy in and take that in from the universe and also give that out on the exhale. One more time. And so ultimately, we're just really grateful to be here and to be of service and to connect with you here. And I think, is there something on this side? This is where the renewal happens, I think. You know, hopefully in the next year, this is a renewal of mind, body, spirit that we're going to all be witnessing and journeying together. And so this is a great quote from Jana Stanfield. I cannot do all the good that the world needs, but the world needs all the good that I can do. So that's one of our mottos is, you know, do what we can, and that's enough, you know, that we're doing our best and, you know, wishing our best for everyone here. We do have a Facebook page that has gone from 0 to 1,000, almost 1,000 members in a year. This is from Facebook, the Capital Integrative Health Community. So you can see that link there, and we'd love to see you there as well. We share a lot of health topics on there, a lot of wellness topics, a lot of topics that are open for discussion, and, you know, not everyone agrees on there, but it's great to kind of have a community to discuss health topics on there. And this is different from our main CIH page. This is another private page, but you're all invited to that. All right, so upcoming at CIH. Jen, is there a slide after this or? Okay. So we are happy, or we are very excited to announce that we are actually starting a podcast, a CIH podcast that is coming around September 2021. We're going to start to record some of the episodes in August, a month before. It'll be called the Root Cause Revolution. If you think about a tree that has roots and you think about the branches of that tree, to address symptoms alone, which is the branches, is not enough to really promote long-term optimal health and wellness. So we want to be part of the revolution of healthcare that deals with and addresses the root cause of both illness and wellness. So Root Cause Revolution is the name, and we're coming in September 2021. I will likely say that many people that you're seeing today, meeting today, or re-meeting today on this call here are going to be on the podcast as well. So we look forward to seeing you there and listening to that. We are going to be transitioning away from this webinar, this weekly webinar, since this podcast is also going to be weekly. So we'll probably do some webinars once in a while, but starting in September, we'll likely be transitioning to the podcast. So we hope that you all can kind of migrate with us there, and look forward to seeing you there. And then Laura, our head IV nurse, and myself are speaking at, we're very thankful and grateful to be speaking at the National Integrative Conference, which is called the Integrative Healthcare Symposium in New York City, which is in September. If any of you are healthcare practitioners and like to register for that conference, it is going to be in person. And I assume they're going to have a virtual track as well. I did not create this slide, but thank you, Jen. I'm presenting in New York. Yes. We're going to be talking about IV nutrition and how that can really help health and wellness. And then we are also really excited to announce that we have a partnership with Bastyr University, one of the leading naturopathic medical institutions in the country in Washington State. We are taking a naturopathic resident this year, and hopefully will stay with us afterwards, but who's actually from Southwest College of Naturopathic Medicine. The partnership's with Bastyr, but we look forward to welcoming her in October. So she'll be joining us as a staff member in October. Her name is Natalie, and I think we'll probably meet her here or on our podcast again fairly soon in the next couple months. All right, so it's time to meet our team. And so thank you so much, everyone, for coming on today, for spending your valuable time with us here. I will just advance my slides, and maybe Jen, you can tell me when to advance stuff. But yeah, so we can start with our medical team. So as you know, I'm Dr. Wong. I'm board certified in internal medicine, have training in integrative and functional medicine, as well as medical acupuncture. And I'm just really feeling blessed right now. It's really feeling blessed to be part of this team, part of this amazing group of individuals in this community. So that's really what I would like to say about, we've grown so much, and we've developed this amazing team over the past 5-6 years now. So I just really am thankful to be part of it. I will say one thing. So this year, our family got some pets during the pandemic. We went from 0 pets to 4 pets. So we have now 2 pet rabbits, and we have a hamster and a Peruvian guinea pig. So these are our pets. So this is keeping us really balanced, at home and stuff. Been reading some books during the pandemic as well. I'm starting to develop a lot of interest in brain health and detoxification. That's kind of what I'm really into right now. So yeah, I don't know if maybe Dr. Toyin, you wanna go ahead or?
Yeah, sure. Hi everyone. My name is Toyin Alakija. I'm one of the doctors here at CIH, feeling very, very blessed to be here as well. I'm a family medicine doctor, and I have training in integrative medicine, and I'm doing my functional medicine training as well. I've been, since joining CIH, some of you who have been here longer, I joined CIH in the past year, and it's been amazing. Great team to work with. I've had a lot of fun getting to know some of you. And I tend to focus more on like women's health, but I'm learning a lot across the functional medicine gamut. Anything from like PMS to like prenatal integrative support, to menopause, yeah, all of the things. I really believe in sort of just you being aware of your body and then working with us to sort of come up with the best plan for yourself, for you. I love cooking and painting, and yeah, I think that's about it.
You're like a professional artist too, right? I mean, your paintings are amazing. Yeah.
I definitely, that's been on hold during the transition, but I definitely want to get back to painting again,
Yeah.
and yeah, I love it. Yeah, definitely.
All right, thanks, Dr. Toyin. All right, EJ, I think is up.
Thank you. Hey, everyone. I'm EJ. I'm a physician assistant here at Capital Integrative Health. I guess I should say soon to be physician associate too, as our practice did get a title change, which is kind of awesome. So
Oh,
very
wow.
excited for that. Yes. Yeah.
Amazing.
Let's see. I do integrative and functional medicine here at CIH, as well as primary care. Also, like Dr. Toyin, in the process of going through the Institute for Functional Medicine modules, which have been really informative and just have taught me so much over the past year, which has been great. In terms of what I like to focus on here, I like everything, but I think toxins and EMFs have kind of come to the front of my radar on how, you know, our environment impacts our health and what we can do to mitigate those risks. So that's been one of the big things. This past year, you know, I started in CIH at CIH, and then 2 weeks later, you know, our office closed down and the pandemic started. But just looking at the positives, it was really gave me the chance to focus on building myself here in my career. And it's been a very exciting time. And I've had so much fun growing with everyone here in this past year. So it's been great. When I'm not here working, I really love to be on the lake with my family. I love my family very much. I think I saw my mom on here. Hi, Mom. And during the winter, we love to go skiing and hang out with our dogs. So yeah, lots of relaxing time.
Awesome. Thanks, EJ. And Marna, this is your debut on the CIH webinar. Welcome, Marna.
Hi, everybody. Hi to new patients and maybe new people that I've not met. Yes, I've been here basically around since the beginning. And so it's been exciting just to see, to grow with CIH and just to see all the changes that have come. I think we've grown so much just in patient care and in modalities. And so it's been great. I think what I focus more here, I focus a lot on infection and acute infections. I work a lot with Lyme patients and other chronic and infections with people. Also, what I really like though, I think what even motivated me years ago to get into functional medicine a lot was even just with hormonal health, along with Dr. Akalaja, we call it. I always Dr. Toy and I always butcher your last name. But anyway, I really enjoy working with postmenopausal women, and I work with hormonal health as well. And so that is a particular focus of mine as well. During this COVID period, if you just saw my picture on the other slide, I don't look quite the same. I did a transformative thing and I thought, all right, I'm going to not color my hair anymore and go gray. So I'm really on the in crowd right now because a lot of other women my age have done the same thing. So, but I am still the same person. So other things that I do, apart from being here at CIH, I mean, I love to keep active. I love to walk. I do some bicycling. Sometimes I even go to the local grade school and I shoot baskets, and I love to play basketball. So anyway, that's me. And so hello to all.
Thank you so much, Mara. Awesome. I'm gonna share my screen for a brief second just to share with you our amazing nutrition team, and you can see everyone here as well. So I think we have Araceli, Holly, Ayla, and Jen, and you can see them here. I thought it would be good to just kind of maybe stop share and we can kind of go back to this, but because everyone is on here, so I think that's probably fine. But Araceli, welcome to the webinar today.
Yes, thank you. Hi, everyone. Good to see you all here. My name is Araceli, and I'm a nutritionist, and I came here to the US to study integrative medicine and then do the certification in functional medicine. And being here at Capital Integrative Health has really taught me a lot, working with Dr. Warren and all of these amazing teams. So I'm really grateful about that. I really like to focus on gut health, and also we've been focusing with Dr. Wan on brain health, which has been really amazing, and I've learned a lot about that as well. Outside from working, I do enjoy a lot of outdoor activities, and I love animals. So I recently adopted a puppy that came all the way from Puerto Rico, now he's part of our team as well. So he's training to be a therapy dog, and he's coming to the office. He's doing great. So there's one more member of the team.
Is he available, or is he sleeping right now?
He is right here. So Pancho. There we go.
All right. Pancho
yeah.
is in the house.
Pancho woke up from a nap, but yeah, he's excited as well. He's really happy to be working, and he's a little tired. Thank you, Pancho.
All right, great. Welcome, Pancho. And thank you so much, Araceli. That's so great.
Yes.
So let's see. Okay, so Holly is next. Welcome, Holly. I think you've been on at least once before here too.
I've been on one webinar before, but hi everyone. It's good to see you all here. I'm relatively new to the team. I've been here for going on 3 months now. And I feel really lucky to have found this opportunity and be part of this really caring and really compassionate team. So I'm really happy to be here. I'm a nutritionist, and before coming here, I had my own practice where I focused on family nutrition and pediatrics especially. And so I still do have an interest in that. And so, you know, I know we don't see many children here, but if you have kids, we can talk about how, you know, we can work nutrition into the family area versus just like focusing on you and being a short order cook and cooking for your kids separately. But beyond that, I really do have a lot of interest in mental health and nutrition as well, and cognitive health and behavioral health as well. So that has kind of been something that I've on my own kind of tried to learn a little bit more about. But since coming here, I'm finding more and more that everything kind of comes back to the gut so often. And so that's kind of been broadening my horizons as well. Outside of work, I have 2 kids who keep me very busy. We like to go hiking and camping and do stuff outside. I have a cat who is new to our family. She's a pandemic kitty. So that's been really just nice to have that, you know, that kind of distraction from everything else going on and just kind of keep us balanced. And I love to garden and cook and make art. So I have a lot keeping me busy outside of here too.
It's great, Holly. Thank you so much. You have the artist connection with Dr. Toyan and the pet connection with Araceli and others too. And you said the rescue cat as well, or?
Well, it was a family friend had to unfortunately get rid of her because of allergies in the family. So we adopted her from them.
Got it. Great. Thank you. Great. And I think Ayla is next. Welcome back, Ayla.
Hi, everybody. It's been a minute. So I've been at CIH. My name's Ayla. I'm a nutritionist. It's been a while since I've been on camera. I've been on maternity leave for almost 3 months now, and I'm coming back in the beginning of July. So I'm looking forward to seeing all of my, you know, patients and everybody again and my colleagues. And so I've been here for almost exactly 2 years now. I started out as an intern, a nutrition intern, and I've done most of my training in gut, but I have a strong affinity for women's health, just like Dr. Toyan and Marna. So I can come at it from the nutrition side. I really like preconception, conception, all the way through breastfeeding and, you know, all of that. So I started out as an intern, then I came on as a nutrition assistant, and then I came on as a nutritionist full-fledged. So I thank you, Dr. Wong, and everybody here for accepting me in all my roles that I've done. Outside of here, lately I've been in survival mode. So I was gonna wear something nicer, but I ran out of time. And I have a 11-week-old now and a 7-year-old. So like I said, I'm coming back from maternity leave and I'm looking forward to that. And I was going to show you her, but she's napping. So I think that's about it. I'm a lifelong learner. I'm currently working on a certification in women's health herbs, herbal health. Sorry, my wording, but and you know, I always love to learn new things. So. And I'm looking forward to working with you, Holly.
So great. Thank you so much. Awesome, Ayla. And Can't wait to have you back. You're coming back in July, right? Couple.
Yep.
weeks now.
Yeah, should be the first week right after 4th of July.
Great. Okay, let me share my screen. Very excited about that. So we'll go to Emil. So Emil is, and Dr. Hiza, and maybe I'll say a little bit about Dr. Hiza. Maybe Emil, you can also jump in and stuff. But Dr. Hiza is a good friend of mine and of the practice, and we've known each other for a long time. Started seeing
Emil, your audio is making that noise.
Dr. Hiza has seen patients here for the past year, and I think it's been such a blessing for many patients, even probably people on here. If you've seen Dr. Hiza, been really helpful for structural health, bone health. Emil also works with Dr. Hiza as a PT assistant, but maybe Emil, you could talk more about yourself. So welcome, Emil. I think this is your second time on here too.
Yeah, second time. Is this better, Jen? Is the
Yep, sounds
feedback
better
one?
now.
Okay, good. Yeah, I think I took up the headphones. I think it was my headphones. Hi, everyone. So Emil, again, licensed PT assistant, certified personal trainer, been in the field for about, and just overall movement for about 12 years. So it's been fun. I got a bunch of different certs in movement, so everything movement. So certified vestibular and balance specialist, strength and conditioning coach, certified geriatrics, kinesiotaping. But my specialty is like ergonomics and injury prevention. So that's I've been really focusing a lot on and digging deep in ergonomics. So I'm a certified ergonomic specialist as well. So I really like adjusting, showing people how to adjust their workstations, as well as avoid faulty movement patterns, things to avoid getting injured, right? So little things like adjusting your height of your monitor, posture, and anything to help avoid you getting hurt, right? What got me into the field is I would help people in the clinic. They'll feel great, and then they go back to a bad situation or a bad environment. And it only makes sense that a lot of your pain and your discomfort is going to come back if you're sitting hunched over at looking down at a laptop or hunched over doing something that can add up repetitively for over and over and over. So happy to come on board and support the rehab team. That's been fun. So I think on a personal note, this past year, I think I always try to give a like a title to each year. I think 2020, the year, the way I summarized that for me was the year of resilience, right? I think it really showed us we really had to adapt. It shows like how well do you adapt when almost everything that you think, right, that gives you happiness is gone, right? Like you can't do anything, you can't travel, you can't do a lot of things that you really want to do. But how do you adapt? How do you still find purpose? How do you adjust to that and still find a way to kind of to still be happy and do purposeful work and still find a way to just find peace, right? So I think I grew a lot in that sense. Just find a way to just change and my mindset. So I'm big on like a lot of mindset and personal development. So just find a way to still kind of adjust my thinking and find a way to still again find peace and happiness and amongst chaos. So I think I really grew a lot. Probably one of the years that I grew up most in my entire adult life. I probably grew the most this past year. So yeah, man. So excited to come on board and looking forward to meet everyone that I haven't met yet.
Welcome, Emil. I'm excited to have you, and I think we all need you to adjust our postures at work and in our cars and things. So we're really excited to talk more about that. And you'll also be seeing patients here at CIH in person, which I think the great way to do ergonomics. Great. Well, excited to have you here. Thank you so much, Emil.
Thank you.
And actually, sorry, I didn't mention Jen. Jen is obviously one of our main nutritionists here, integrative functional nutritionists. Jen is going to be making a conversion to a full-time marketing director of marketing here at CIH. But Jen, I'll let you say more about your role moving forward.
Sure. Yeah. So I'm Jen. If you've been on a webinar before, you probably see my name like hidden behind the scenes here. But I've been a nutritionist here for several years. I'm working with cardiometabolic health and gut health, and I really enjoyed that. And I love working here because it's just so fun to work in a place with the topic you're passionate about and see people improve. And the group here that we work with is really awesome. So very thankful for that. And I have been doing nutrition and also work on other things on other days. So I'm moving towards doing that more full time now. And part of that is things like the podcast and building up like our classes and our group visits and trying to branch out a little bit and help to bring a little bit of what we're doing more to like a broader community. So I'm excited to be working on that. And I think, yeah, if you are a patient of mine, I've been trying to talk to everybody, but we are going to be having a transition to some of the other nutritionists. So we're glad to have a team here to help with that. And when I'm not working and I'm a part of this team, I love to be out hiking and with my dog. And if I can dance, COVID kind of killed that, but hopefully as the world's opening up, can get back to dancing. I like to do that kind of stuff.
What kind of dancing do you like to do, Jen?
Anything, but I have a soft spot for hip hop, which I know is probably surprising.
All right,
but
there we go. Top video coming up.
Yeah.
Great. And Jen, you're amazing, honestly, at nutrition, at the graphics, Jen designed the whole website, has been really intimately involved in the logo design, the website, a lot of the things we're doing to bring this out to more people, right? Because if people don't know about us, then, we can't be of service to people. So thank you so much, Jen. I really love working with you on the group visits too. You and Araceli have been really instrumental in preparing those and, working on that together, and everyone that's been doing group visits really. But yeah, thank you so much. So that transition will happen when again?
August.
August, okay.
Yeah.
So, Jen's in touch with her patients about that. And, Araceli, Ayla, and Holly are amazing nutritionists, and you'll be well taken care of here as well if you're a patient of Jen's. And you'll see Jen a lot on the podcast, I think, at least certainly behind the scenes.
You won't see or hear me, but I'll be there.
Yes, Jen is definitely part of that, main part of that.
Yeah.
Great. All right, so I guess I should share my screen again and go back to the slides. All right, so we have Dr. Amina Keats, who's a naturopathic doctor and also has a specialty in naturopathic oncology. And Dr. Keats has also been here for a while now, and so welcome, Amina, to the webinar again.
Thank you. I'm so excited to be here. And so I've been with CIH for a whopping 5.5 years, and I moved here from Maryland. I moved here from Philadelphia to Maryland. And soon after my family and I moved here, I was connected with CIH, and it's certainly been a wonderful experience. So I am a naturopathic doctor, and I'm also board certified in naturopathic oncology. So most of the patients that I see do have a current cancer diagnosis or history of cancer, and mainly work with patients to reduce any side effects that they experience with their treatment. And then I work pretty heavily when it comes to cancer prevention, whether that means preventing reducing the risk of cancer coming back, or just reducing the risk of cancer occurrence altogether. And so that's generally what I do. I do a little bit of general medicine as well, but mainly definitely in integrative oncology care. In terms of things that bring me joy, I certainly do enjoy working with patients, but outside of work, I enjoy exercise. I enjoy laughing. I try to find laughter in something at least a couple of times a day. I enjoy spending time outdoors. I enjoy learning. I'm also like a lifelong learner as well, but certainly happy to be here on this platform with you today. And it's been a joy working with this group of folks here.
Well, thank you so much, Amina, for sticking here on the team. And I really want to acknowledge that you especially, and I think everyone here, when we have questions and we don't know the answer to things, which is like every day, right? You don't know the answer to a lot of things, right? We can look at the whole team. And so when you're here as a patient, you get the whole team approach and the input from everyone. So if we have someone, say, with a history of cancer or risk of, we want to talk about secondary cancer prevention, we'll send people to Dr. Keats. We'll ask her questions. She's so good about getting back to something about that. So really appreciate you being here as well. And we will have to do some joke exchange or laughing exchange sometimes.
I actually have a joke if we have time for
Yes, let's go. It's great.
Okay. So I'm kind of a cornball, and you'll see why when I tell you this joke. Okay. So why did the boy eat the lamp?
Good one. That's a stumper.
Okay. The boy ate the lamp because his mom told him to have a light snack. So see, when I first read that joke, I was in stitches. So it's not easy for me to find laughter, as you can see.
Yeah, nice. Thank you. Thank you for sharing that.
I mean, not hard.
Emil's looking up. Are you
Light snack, lamb, light snack. I'm being kind of slow right now. Yeah, I don't get it.
So the lamp being, light, emitting light, and his mom told him to have
you
a
said
light
lamp.
snack.
Oh, I thought you said lamb. Oh, lamb.
Oh, no. Why did the boy eat the lamp?
Lamb is kind of a heavy food, I was like,
Gotcha.
Yeah.
Okay. Yeah, I thought you said lamb as well.
Oh, no,
Okay,
lamp.
I'm with you now. Okay.
all right.
Yeah,
The light bulb just went on all of our heads. So
Yeah.
yeah, thank you for
And feel free to share that joke if you like.
Christine said I
I
thought
love
maybe
it. I love it.
yeah, Christine said I thought maybe because he was bad was the reason for lamb. Okay, that's another secondary
That's
joke.
a good one,
Thank
Christine.
you, Christine. Thank you, Christine. Yes. And that's my joke. We just had the light bulb go off. So you obviously did that so we could get stumped and the light bulb could go off in our heads. Yes, the EMF webinar, just one question from Susan. Yeah, we're gonna have recordings of all the webinars if they're not up yet.
Yeah, I'll share the link.
Yeah, great. Thank you for that joke. And we know that laughter is the best medicine. So thank you so much, Amina. All right, we have Liz Reese, who is our amazing heart math instructor, health coach. She actually has a health and wellness coaching certification now. Liz, can jump in more. I love working with you with all the group visits on heart math and heart math in general. So welcome, Liz. Welcome back.
Hi, everyone. As Dr. Wong said, I'm Liz Reese, and I've been here with Capital Integrative Health for about a year. I started right after the pandemic hit, and I have been so loving being a part of this amazing team. I am actually currently located in El Salvador. In the midst of the pandemic, our family moved, but luckily, the amazing technology of Zoom has helped this transition. So I'm still able to be a part of the team, and that's wonderful. So I am a health and wellness coach. I help people meet their wellness goals. I am also a heart math coach. And so my passion is really working with people who have a lot of stress in their lives, and this stress is really impacting their physical well-being. And so I work with patients who want to help to regulate their autonomic nervous system away from being in a mode of stress into a mode of coherence. And the main technique that I use is heart math. And so I work one-on-one with individuals and also do group visits as well with Dr. Wong and EJ. And those are a whole lot of fun. I'm loving them. What else? So outside of Capital Integrative Health, I love to sail. I love to travel. I have got 2 kids who are awesome, 2 teenagers. And yeah, I love being outdoors and playing with our cats. And so, yeah, that's it.
Great. Thank you so much, Liz. Yeah, it's been so fun working with you on the webinars and on the group visits, the heart math. And I really think that's one of the most important, amazing things we've done here at CIH for the past year is, we know that this has been a really stressful time for everyone, and I think regulating that autonomic nervous system and balancing the heart and brain, mind, body, spirit is super important. So thank you so much. All right, so we are on to Corey and Liz, who couldn't be here today, but Jen, what should we do here? Should I just say something about them?
Just share kind of briefly,
about things. Corey is an amazing acupuncturist, healer. I've heard people say, and Corey, when you're listening to this, sorry, but that you're the best therapist they've ever encountered because he's such a good listener. He's like such a good listener, and he's really also doing a lot of breath work. I know from just knowing him personally that he's run marathons. He's like super in shape, but he also knows about not only the body, but also the mind and spirit, and really focuses on that a lot in his acupuncture treatments. I've gotten treatments from him myself personally, and just a really great friend. I'm lucky to call him a friend, and he's at CIH 2 days a week. And then I think what he does in the other times he's not working is he does like woodworking, and he built out his whole basement, you know, himself and things like that. He has a bunch of woodworking pieces that I'm waiting for him to launch his woodworking company so we can buy some pieces from him or something. I think anyone else can jump in, because I mean, you probably know other things about Corey that I don't know. So please just jump in, anyone that's here.
I can say one thing about Corey.
Thank you. Yeah, thanks.
Corey will work with any patient, like any situation that, you know, might be weird or off the cuff. Like, he's willing to work with anyone to try to come to a solution. I love that about him. Yeah. Him and Liz both really have been such a huge support.
Thanks, CJ. That's a great point. And Elizabeth Barrett, Liz is our co-founder here at CIH. So Liz and I started CIH back in 2015, about 6 years ago now. And Liz is also a dear friend, and she is an acupuncturist. She also has gotten into psychedelic medicine and is in a training program with that now, is working with Tara Brock and doing a mind-body 2-year fellowship or mentorship program with mindfulness there as well. So really amazing, special individuals here, and really great that they're here at CIH. And Liz, I think also, I know she works with patients with fertility and general wellness. Does anyone know the exact other things that she likes in terms of you know, health conditions and things like that? I feel like she probably does they both deal with women's health, I think, I would say. But yeah, if you're looking for kind of a gentle approach, I think both Liz and Corey would be great. All right, so Carrie is our massage therapist, and she really concentrates on myofascial release, which is a little different than massage. And she deals with a lot of people with chronic pain conditions physically, also emotional conditions, releasing some of that trauma that people may have stored up in their tissues. And there's a saying in, I think, myofascial, that the issue is in the tissues. So this idea that we store emotions in the body, it becomes a bit kinked, a bit tight. So we want to release that, and that's going to help mind, body, and spirit. So Carrie is another amazing practitioner here, a healer. She does quite a bit with her clients physically, but also mentally, emotionally, spiritually. And if anyone wants the same thing about Carrie, I know a bunch of people have gotten treatments from her. So please feel free to mention anything about Carrie. I think she's still, she is somewhat booked right now, but we definitely, you know, she can see patients, we'll send her a message as well. All right, is Laura or Meg here? I think not yet. Okay, so Laura and Meg are IV nurses, do IV nutrition therapy. So they're both registered nurses. Laura is also a certified nutrition specialist, and she's presenting with me in New York City on IV nutrition talk that we're giving. Meg is also a certified nutrition specialist candidate and a nutrition student herself. So both of our nurses are also heavily involved and interested and passionate about nutrition and natural ways to treat people. So it's a great kind of unity of the medical and the nutrition with IV therapy. And I know that if anyone's gotten IV therapy on here, just kind of raise your hand, or what your experience has been great. I think IV nutrition is one of the big game changers for our practice that's really helped people. So yeah, go see them there. They're amazing. We do a lot of IVs, I would say, to boost the immune system, to help with energy, to help with fatigue, help with migraines, things like that. Also to help with chronic infections. Marna will see that a lot. And then brain health, I think, is another big area too. So Tony is their functional health coach, and she is, as it says here, I can read what she has to say, but bridging the gap between where her clients are and where they want to be for their health and wellness, by guiding them and understanding kind of their innate, sort of the inner strengths and wisdom to create goals that are meaningful to them, meaningful to you, so you're motivated to sustain these lifestyle practices that are really required to maintain and build health. So she provides accountability and follow-up to increase your chances of achieving goals, but also new perspectives and ways of thinking to resolve and overcome obstacles and challenges, and then sharing as appropriate success strategies, resources, and tools. She is also in the Functional Medicine Coaching Academy, which is also part of the IFM kind of training as a health coach. So she is finishing that, I think, in August. So that's very exciting too. And she is working with people also in groups with EJ. And maybe EJ, you want to say something about Tony since you're working a lot with her.
Yes, I was going to put in a shameless plug for my class, our class that we teach. So Tony and I have been working together to teach a class called Start with SMART. And SMART is our acronym here at CIH. It stands for Sleep, Mindfulness, Activity, Real Food, and Ties. So basically, we're trying to bridge the gap there and really focusing on, you know, some information, but really tips and tricks that you can use to actually be successful in making lifestyle changes, which we know here at CIH is like the foundation to getting well. And there are changes that you can make that are so simple that can make a huge difference. So if you haven't been to that class, I highly recommend it. Tony is amazing. She is such a fun, positive person to be around. So I highly recommend it.
Her energy is amazing and
It is
very
amazing.
It spreads to you very quickly. Yes. So if you want to feel better, go see Tony and go to EJ and Tony's SMART class, and you will, the light bulb will go on when you do that.
Yeah,
so.
There you go.
And all right, so we're going to go to Dr. Diane Gilman. So Dr. Gilman, she's another friend of ours here, been with the practice. She's another OG, been here for 5.5 years. She provides holistic mental health care. She's a doctor of psychology. She was here 2 days a week, and now she's transitioned completely to telehealth because of the pandemic. So we do miss her seeing her in the office, but she is still seeing clients, you know, on telehealth. And I think the thing with Dr. Gilman that's I really find funny. She's just a very fun person. You know, you can just talk to her. She's very down to earth. If you have stuff, mental, emotional health concerns to share to her, you know, she takes a very systematic yet root cause approach to the issues that you might have. And then I would say, yeah, other than that, I think she is also creating another company for healthcare professionals, for mental health professionals to go travel. And I think it's called, does anyone know what it's called? She actually has a company where she travels and she takes other psychologists and mental health professionals around the world to travel abroad. So I think that's really amazing. So if you ever want to, you know, see pictures of amazing worldviews, you can follow what she does with her company there. All right, so Dr. Mark Davis. So Dr. Mark Davis is a naturopathic gastroenterologist. He did his training in Portland, and then he came back to Maryland once the ND profession started to get licensed here. So he's been with Capital Integrative Health now, thankfully, for several years, and really kind of focuses on inflammatory bowel disease and also fecal microbial transplant. I think are his two main areas of interest, and is really a world expert in FMT. So, and we know that fecal microbial transplant is probably one of these up and coming innovative therapies that can really help and treat a lot of gut issues. So if you have any chronic gut issues, you know, we will often refer people to Dr. Davis for that. And he couldn't make it today, but he's always also very super positive and smiley. And I think he does a lot of interesting things that I don't know exactly all the different details to that, but I think has his own. If someone else wants to say something about Dr. Davis, that's fine too. Yeah, I know he's doing some different things in his garden and things like that. So I will actually go to Dr. Grady. So Dr. Grady is our osteopathic doctor. I know he's helped a lot of people as well, and he also deals with chronic pain, you know, neck, back, knee pain, and kind of the whole gamut of musculoskeletal conditions. And, you know, we're really thankful to have him here as well, as part of the kind of the aspects of, you know, structural musculoskeletal health. So Dr. Grady's here a couple of days a week as well. Maybe Araceli, do you want to talk about some of these here? And then I think we can go to the, if anyone else has comments. Thank you so much. Yeah.
Do you want to go to present mode, Dr. Wong, so we can see the whole screen?
Oh, okay. So I can stop my share, I suppose. Yeah.
Oh, no, sorry. I meant like bring the screen up and just go to the present mode because it was in the slide view.
Yes, I can do that too. Great. Thank you.
Yes, so one of the modalities that we have here available is red light therapy. So it is a combination of red light and near infrared light that is not really visible to us, but basically you stand like in between both panels so that you get the most exposure, both front and back, and it is activating the mitochondrial function. So that little battery in our cells that is going to improve the function of our cells that could be in different places. It can be the thyroid, it can be the eyes, it can be the skin. So it has both like superficial benefits from the skin, and it also has like internal benefits from activation of the mitochondria. So there's many benefits from like circulation, inflammation. It can help mental health, decrease pain. Even they have some studies regarding cognition, which is really interesting, and also for sleep optimization. So many reasons to try and do red light therapy if you can. It's very short. It lasts about like, you only have to be there for 10 to 15 minutes. So if you're ever in the office, you can request doing some red light therapy, and it'll give you a boost of energy and well-being.
It's really great. If you 10 minutes of that, your day, you're good. You got the juice for the day, right? Maybe Jen or Araceli, do you want to talk about InBody at all? How we use that?
Sure, I can talk about it. So this is just something we wanted to share because I think a lot of patients may not know that it's a part of the office and available to you for free. It's the InBody body composition. So it's a scale. It takes about 45 seconds to do its thing. And it will tell you all about your body composition in terms of muscle mass, body fat, visceral fat, water retention. Just gives us a much more in-depth view of your health and even your cardiovascular risk. So when we're talking about diet and how we're going to recommend what next steps you can take, it really helps us to personalize and also track your progress specifically. So just to remember that that's available too, and a really helpful, something that's really helpful. And I think there was a question if it's used in annual appointments. I'm not sure actually if it's officially used, but we do use it regularly for the nutrition visits. I don't know if the medical team.
Yeah, we've thought about it. It's a great question. Like, should we just include it on annual appointments? I think it's something we could think about. It's just a flow thing, but yeah, if you definitely want that during your annual appointments or any other time you're here in the office, we can definitely accommodate that. So it's a really great tool to use to, like Jen said, know what's kind of going on internally in your body. So, so that's pretty much it. So thank you so much, everyone, for joining us today. We look forward to seeing you back in person sometime, and hope everyone's staying safe and healthy and having a great summer here. And we will see you next week as well at the usual time at 12 o'clock. Thank you, everyone, for coming on today. And yes, we'll see you soon. Thank you so much.